don't know what your problem is. All right, here we go. You know, this is not exactly breaking news. You probably have heard that childbirth can really take a toll on a woman's body, and sometimes getting your form back takes more than diet and exercise and time. Joining me now to talk about Mommy Makeovers is Dr. John Alspaugh from Associates in Plastic Surgery. Welcome to the Hampton Roadshow.
Thank you, Carrie. Thanks for having me.
So the first thing I want to say is, you know, this isn't just for mommies, and I don't want any woman who has just had a baby to think they need to just rush right out and, you know, try to look perfect again. But when you get to that point where you're like, okay, it's time to feel more like me again, I think this is where somebody like you could be very helpful.
Right. You know, we know that parents love their beautiful children, but sometimes moms aren't all that happy with some of the effects of pregnancy on their appearance. And so there's a term called a mommy makeover that was coined to describe that series of procedures designed to kind of reverse some of those changes.
Yeah, and in the areas that, let's face it, take the largest toll through the process of not only being pregnant, childbirth, but then breastfeeding too. So let's start there. What specifically can you do in terms of getting the shape back in?
Well, Mommy Makeover is really a series of procedures. Usually includes something directed at improving the shape of the female breast, and then also something to flatten the stomach, such as a tummy tuck. It's really good to do these things together because even though they could be done separately, doing them together cuts down on costs, cuts down on time in the operating room, which is important, but most importantly, cuts down on recovery time. And for busy moms, decreasing recovery time is really important.
Yeah. Let's talk a little bit about timeline, though, because, you know, I talked at the top of the segment. I think it's important to be kind to yourself and gentle with yourself and your expectations. But is there a time window? You know, my children are 11 and 12. Is the window closed for me? Is this best for women who are closer to when they had their children? Or?
No, absolutely not. This is something every woman should choose, just as you said, when they feel like it's right for them. So it's something that could be done maybe as soon as a few months afterwards. But for most women, I think it's more so like a year, 2 years, or any time thereafter.
And I would imagine women should really consider what it is that they're doing in their daily life. If you're still nursing, if you're still carrying an infant, that is going to affect recovery.
Exactly. And we counsel people in the consultation is that, you know, for you, maybe you ought to wait a while longer, and usually somewhere around 3 months after the completion of breastfeeding is usually a standard. We think it's okay to consider doing something. That'd be kind of the earliest.
Well, that's good to hear that you're very realistic with women about that. I think sometimes doctors get a bad rap that, you know, maybe they just want people to just come in and do things, but it just doesn't make sense if it's not
No,
time.
it doesn't, because, you know, the goal is always to have a happy patient. So if you sort of led someone down a path that they don't really want to be on, that's not what we're looking for. We're really here to sort of help them with achieving the goals they want to achieve.
Yeah. Folks will be concerned about the aftermath, what they should expect in terms of scarring.
Right. Well, you know, everybody's concerned about scars, and so am I. So the way I do it in my practice, I want to make the scars as least limiting as possible.
Okay.
So what we do, we just plan the surgery so that by the time the next summer comes around, you'll be able to wear whatever bathing suit you want and pretty much be happy that no one else knows this has happened.
Okay. And are these things, you know, are they considered minimally invasive? Is this?
No, this carries
invasive.
Real surgery. You need to sort of sit down and meet with a board-certified plastic surgeon. You need to have him tell you exactly what's the best options for you to make sure that you know what you want to accomplish and what it takes to get there.
Okay, that is so important that you choose the right person with all the credentials and certifications to do this kind of thing safely and effectively. Thank you so much, Dr. Alspaugh, for coming on, for being that person. Associates in Plastic Surgery is located at 1037 First Colonial Road in Virginia Beach. If you've got questions about this, if you just want to start getting some ideas, doing a little research, go to associatesplasticsurgery.com, and you can also find them on social media. Do you have before and afters on that site?
Absolutely.
I knew you would. You know you want to see those before and afters. Go to the website and you will find it. And you can find Dr. Alspaugh on social media at Dr. John Alspaugh. Thank you.